Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of January 22nd, 2024. Following a status update on COVID, flu, and RSV, I will discuss California's new isolation guidelines or lack thereof, and kids, school, and COVID. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information that will help you make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there is still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Nationally, wastewater viral activity level for COVID remains very high, and the region that has the highest wastewater viral activity remains the South. Preliminarily, at least, wastewater concentrations appear to be coming down. We will keep an eye on it. Note that this data includes over 1,000 wastewater sites across the country, representing an estimated 35% of the U.S. population. Taking a look at weekly new hospital COVID-19 admissions, we are at 32,861 new hospital admissions for the week ending January 13th, and this is down a bit from 35,801 the week before. After 9 straight weeks in a row of increases, this decrease is definitely welcome to see. So hopefully we will continue in this direction. But still over 30,000 new hospitalizations per week. This is quite a number of people being hospitalized. And when we take a look at deaths, we are looking at the week ending December 23rd, because as we know, this data takes a little bit more time to finalize, but we had at least 1,712 deaths the week ending December 23rd. So that was the 4th week in a row where we have had over 1,600 deaths per week. And this is a lot of people dying every single week. This is more than triple where we were for most of the month of July, when we got down to around 500 deaths per week. And we know that many of these deaths could have been prevented. First off, by doing everything we can to prevent the spread of SARS-CoV-2, by being up to date on vaccination, and by accessing outpatient treatment as soon as possible after testing positive for those who should be treated. And if you should be treated if you get COVID, you should know that now. Do not wait until you get sick to see how you will do. That is not how that works. That can end up being too late. Unfortunately, access to outpatient treatment seemed to be getting harder, not easier. So even if you had a good plan that might have worked 6 months ago, 9 months ago, a year ago, it might be time to check to see if that resource is still going to work as the landscape continues to shift. And taking a look at COVID and influenza hospitalization rates together, we can see that hospitalizations for COVID are much higher than flu pretty much all the time. But what I wanted to note is that for much of the year, flu hospitalizations and death come down basically to zero for much of the year. But unfortunately, with COVID, we know that is not the case. And what we would call our baseline or our low doesn't actually get very low. So we know that SARS-CoV-2 is not particularly seasonal. We know it never gets down to zero. So it's just something that we contend with year round. And we seem to have 3 to 4 peaks per year. And taking a closer look at influenza in the United States for the week ending January 13th, positive flu tests are coming down, as you can see on the graph there, but you never want to assume with flu that this is it. Sometimes it can go down and come back up, but seeing both tests and hospitalizations coming down at this time is certainly reassuring. The week ending January 13th, there were 14,874 patients admitted to the hospital with influenza. That is coming down. It's less than half of what we were seeing with COVID hospitalizations for that same week, which was over 30,000. So far this flu season, there have been an estimated 180,000 hospitalizations and 11,000 deaths, and 47 of those were tragically pediatric flu deaths. Taking a look at RSV nationwide, cases seem to be coming down there as well, something we will continue to keep an eye on. And taking a look at COVID, SARS-CoV-2 variant proportions, JN.1 is very dominant now. It's at a projected 85.7% of specimens in the US as of January 20th. And this is going up pretty quickly. It was about 62% 2 weeks before that, now at about 86%. JN.1 is also the dominant strain in our wastewater. We know that JN.1 is highly mutated and very contagious, but fortunately, it does not seem to be causing more severe disease from what we can tell so far. And the good thing here is that there's continued surveillance for new variants, both in the wastewater and in patient specimens. So hopefully that will mean advance warning in the event of anything very different from what we've seen. For now, our vaccines continue to work well enough against JN.1, and our treatments remain effective as well. Now, in a recent surprise move, both Oregon and California have basically bypassed the CDC and come up with their own less protective guidance on COVID. And this is the first time in the whole pandemic that I can recall of California being less protective than the CDC. In fact, it has historically been the other way around. On January 9th, the California Department of Public Health kind of quietly issued a public health officer order that made a major change to isolation orders for COVID-19. Essentially, what it does is remove the need to isolate, even if a person is known to still be contagious. And this is highly concerning for a number of reasons, and I think caught a number of people off guard, myself included. What the order basically says is that from the time a person gets symptoms until 24 hours have passed without a fever, and that's without using a fever reducer. So 24 hours have passed without a fever, and if the symptoms are mild and improving, then that person does not need to isolate. Also, if a person tests positive but they don't have any symptoms, they're also not required to isolate. And unfortunately, that is really the entire gist of the order. Basically, you don't need to isolate even though we know you are contagious. Or we can be fairly certain you are contagious, or we could check with an antigen test to see if you are likely contagious. It's not until you click around to the related materials that you see what I would consider critical parts of the guidance, except they're not that easy to find, but I'll get to those in a moment. I also find it interesting that the order states that the public health officer will continue to monitor recommendations issued by the CDC when the CDC, in fact, still requires 5 days of isolation. Will that change? I have no idea. I hope not. In fact, I feel quite confused about why this is happening in California in the first place, or in Oregon in the first place. What the order cites are very general statements that frankly don't really hold up. And I'll get more into that in a moment. But first, I want to talk about the parts of the guidance that I don't want us to lose sight of, mainly because at this point, they're kind of all we've got. So, first is stay home if you have COVID-19 symptoms until you've not had a fever. And it says for 24 hours without using fever reducing medications. And if you don't have symptoms, then you should follow these further recommendations. So basically, if you don't have any more symptoms yet, or if you're improving, they still want you to follow these important recommendations. Mask. So mask when you are around other people indoors for the 10 days after you become sick or test positive. And so, first of all, I think you should not go around other people for 10 if you're still testing positive, period. But there is no real provision for that here. What it says here is mask around others for 10 days. And it says indoors. But honestly, if you're contagious, then you're going around other people outdoors, you could still get them sick. So they do say you can remove your mask sooner than 10 days if you have two sequential negative tests at least one day apart. So I wish that that was actually required, but it is just sort of recommending this on another page that is not the page of the order. So again, it's just very flabbergasting to me that this is where we are. But I also want everyone to remember that day 0 is the first day you have symptoms. So the first day you have symptoms is not day 1, that's day 0. Kind of confusing, I know, but it's important because that's when you have to start counting. So day 0 is the first that you have symptoms or the first day of your positive test, and then you start counting from there. Then it says to avoid contact with people at higher risk of severe COVID-19 for 10 days, which includes the elderly and people with immunocompromising conditions. Honestly, I have no idea how anyone would be expected to know who is at high risk for a bad outcome. There are people with autoimmune diseases that you cannot tell from anyone. There are people with HIV you cannot tell from anyone. There are people with all kinds of conditions that could potentially immunocompromise them. They could be on steroids. You would have no idea. You don't know who's immunocompromised. You don't. So this to me is absolutely ridiculous, but they tried. And then seek treatment. So we know how important this is. If you have symptoms, especially if you are at higher risk of severe COVID, then speak with a healthcare provider. I hope you have one. Please get one if you don't. As soon as you test positive, you might be eligible for medication. So that's really what we have, sort of a series of recommendations, no requirements at all, not even that you don't go around other people when you are likely contagious. One of the most concerning aspects of this new order to me relates to schools. And that's because we know that there's a whole lot of mixing that goes on in schools. And now that we rarely see any masking going on in schools, and with this new lack of guidance around isolation, we're basically asking for completely unmitigated spread of SARS-CoV-2 in schools and onward into communities. We know that just one contagious child could infect a number of other people just in one day, let alone coming to school contagious for 4 days in a row. I hate to think about how many people can be infected from one contagious child in the cafeteria, for example, and how many new chains of transmission this could then kick off. The order actually admits that the contagious period begins 2 days before symptoms start through 10 days after. So here we are again, just promoting unchecked spread throughout schools to everyone, including vulnerable students, vulnerable teachers and staff, and onward to the school bus and to vulnerable household members. I'm definitely worried about adults as well. I hope that the OSHA guidance, which still requires 5 days of isolation in workplaces, will remain. It won't do anything about students or customers or clients in various workplaces, but hopefully it will continue to protect workers, and protect the public from those workers. So I hope that this doesn't change. But I am concerned about the overall message that this order is sending, which is that we should just get back out there, no matter that you're contagious, no matter that we should probably rest until we recover and until we're not contagious, and that we shouldn't even necessarily bother testing. It just really boggles the mind. And I'm not seeing any satisfactory reason related to public health or individual health, just more vague statements about being in this new phase. So we're told we shouldn't really worry about kids. We're told that most people have been exposed by now. We're told that there's lots of immunity in the population. We're told that we have the tools. So let's just unpack this a little bit. First, children are in fact susceptible to bad outcomes from COVID. And this has been one of the worst messaging fails of the entire pandemic, which was that we somehow compared children to adults. And that is not what we're supposed to do. We're supposed to compare how this impacts children against other things that impact children. Children can end up in the ER, in the hospital, in the acute phase of COVID at a much higher rate than what we see from other things. And they are also susceptible to that post-inflammatory condition that can affect any organ of the body, that MIS-C we've talked about here a number of times. We've lost over 1,500 children in the United States who've died from COVID already, at least. Remember, I mentioned 47 pediatric deaths this year from flu. That is awful. That is tragic. That is 47 children that are no longer with us from an infectious disease, and mainly a vaccine preventable infectious disease. 47 children that we've lost this flu season. But that number is dwarfed by COVID deaths at over 1,500 so far and counting. In fact, COVID is now a leading cause of death in children. A leading cause of death in children. This is not something that we should just be casual about. In fact, it is ranked consistently in the top 10 leading causes of death in children and young people in every age group. This is a little bit of a deep dive. That was an analysis published in JAMA Open, and it looked at a 1-year period. It was during a vaccination period, so August 1, 2021 to July 31, 2022. And it basically showed that for children 0 to 4 years of age, it's the 7th leading cause of death. For children 5 to 14 years of age, it's the 6th leading cause of death. And for children 15 to 19 years old, it is the 5th leading cause of death. This is serious. So depending on what age group you're looking at, is between the number 5 and the number 7 leading cause of death in children. COVID deaths far outnumber influenza and pneumonia deaths. It is the number 1 cause of death from any infectious disease or any respiratory disease in children. The number 1. And it is causing substantially more deaths than any vaccine preventable disease anytime in our recent history. So this is very significant, and we should be doing everything in our power to avoid these terrible outcomes, knowing that death obviously is not the only terrible outcome, but wanting to really acknowledge and underscore the fact that it is in fact still a leading cause of death in children, and that it is largely vaccine preventable, and a largely vaccine preventable in terms of hospitalizations as well. Yet, unfortunately, we are seeing very, very low vaccination rates among children. Only about 3% of those under 4 have received the 23-24 COVID vaccine, so have not been vaccinated in over a year, and under 10% of those in the 5 to 17-year-old age group. And if you're interested in more detail, I've linked those graphs in the post. But basically, we are under vaccinating children, and new babies are being born every single day. And if pregnant moms aren't getting vaccinated, which we know we also have very low rates of pregnant moms getting vaccinated, then those 0 to 6-month-old babies are not protected as well. And with such a staggeringly low percentage of babies getting vaccinated, they're pretty much just unprotected. So it's still novel to them. And then those children get to school, and we're still unfortunately seeing very low vaccination rates for SARS-CoV-2. So we are awaiting updated death data for 2023. These data do tend to come out a bit slow, but with so many mitigations being dropped, with new babies being born unprotected every single day, with vaccine rates among children being so low, and now with 0 guidance that will keep more contagious children from mixing it up with other children in daycare, in school, I am quite concerned about what is to come. So COVID can cause severe outcomes in children. Okay. The tools, the tools we have for children are vaccination. And I just said they're very, very underutilized in this age group. That's the tool we have for children, basically, because we know that treatments are really reserved for those 12 and up with serious underlying conditions. And even adults with multiple underlying conditions are having quite a bit of trouble accessing treatment. So, and also we know that about half of the children who've been hospitalized with COVID-19 do not have any underlying condition. So once again, when we talk about tools, what are we talking about? So if we can have bad outcomes in adults and children, we have mounting evidence of long COVID, which also does affect children. We have mounting incidence, of long COVID, which does affect children. And we have sustained transmission, which we know is going to lead to more opportunities for new variants to arise. Why are we doing this? There must be a good reason, right? So I can't answer because I'm not a mind reader, but the main reason we've kind of seen alluded to has to do with school attendance. Yet, we have not seen any evidence that the 5-day isolation is the actual reason for low attendance. And I would think that this data should be known and shared with the public before removing protective guidelines. Maybe then we can have a better understanding of why something like this would need to happen. But in actual point of fact, I think it would be fair to say that the reasons for low school attendance are varied. There's a number of different reasons for low school attendance. I know this is something that we've looked into in our local area, and I'm sure that in each local area, there are different reasons that have to do with transportation challenges, they have to do with work schedules, and I think that these need to be looked into and shared, and that those who are responsible for students should be talking about these reasons and working to address these first and foremost, before creating new problems for everyone. So one example that we do know about is that too many children in the United States have actually been left without a parent or primary caregiver directly because of COVID. And I've linked the Global Reference Group on Children Affected by Crises, and they have a number of reports that are very sad and tragic and really actually difficult. But if this is an area that you want to look into, that's a good resource. We know that over 250,000 children in the United States and over 10 million children worldwide have lost a primary caregiver. They may have also lost the person who was earning income for the household. So we know that poverty has increased for a number of households in the United States, and this is something that has been a disproportionate impact for certain groups. But obviously, losing a parent or a primary caregiver is not something that a child can just bounce back from. And I really wonder if the schools have made a systematic and concerted effort to identify children who've been impacted this way and make sure that we're providing them the support that they undoubtedly need. Anecdotally, especially with all of the contact tracing that we did in the earlier days, we know of too many sad, sad stories where a child got COVID and brought it home, and then an adult got sick and did not recover. And this absolutely compounds the trauma these children experience. We really need to be making efforts to help them understand that this is nobody's fault. This is something that is affecting everybody. There's nobody on this earth that has not been affected by this, and really help them to work through the grief with people who are trained and able to do so. We know that schools are under-resourced to really help address children who are dealing with trauma and grief, and then those who are dealing with deep poverty and unstable housing and all of the other things that are compounded. So my heart definitely goes out to our educators, and I worry that these new policies will only add to this issue of more COVID circulating at school, being brought home to vulnerable household members, and the cycle continues. I wish I had confidence that schools had installed better air filtration systems and that they had a way to ensure that there were still remote learning options just for these kind of situations for students so that their attendance could still be counted while they're isolating. I wish we could have taken some of those lessons and some of those tools that were developed and kept them going. But we know that by and large that this is not the case, especially for lower income students. So that brings me to disparities. There is no doubt in my mind that this new policy will disproportionately impact certain groups. I want to bring your attention to this very impressive research conducted by Satcher Health Leadership Institute at Morehouse School of Medicine. It was a 2-year study. It's very, very comprehensive. It's very in-depth. It is also another very sad publication that showed that Black children had 2.7 times the deaths of white children from COVID, double the hospitalizations, and along with Hispanic children, higher incidences of severe cases of COVID-19. And these are also things that can absolutely impact a child and their ability to just get right back with it. And some we know are suffering from longer term consequences as well, which can also affect attendance. Are we asking these questions? Are we identifying students with long COVID or post-COVID issues in school settings to see why there may be persistent issues? I have not heard that this is happening. These are the things that we should be addressing if we're worried about school attendance, not creating a worsened situation that is just going to continue to be, unfortunately, I think, an avalanche. So another sad report on the truth of how this pandemic is impacting our children. It is worth taking a look. Now, the related documents in the California health order say California has a diverse population with no single racial or ethnic group constituting a majority of the population. So that is amazing. We're amazingly diverse. It says our population includes members of tribal nations, immigrants, and refugees. Some groups may be at higher risk for COVID-19 or worse health outcomes due to several reasons, including living conditions, work circumstances, underlying health conditions, and limited access to care. Beautiful. Correct. Absolutely. And then it just goes on to advise us not to discriminate against any group and to provide instructions for those with disabilities. Yet this policy absolutely discriminates and will absolutely disproportionately impact those with disabilities, those who are lower income, communities of color, those who use public transportation, those who live in multi-generational or crowded housing, those who attend more crowded schools in more antiquated buildings. And now that school level data is no longer being shared, we are really unable to truly monitor these disproportionate impacts. So if you've been watching the People's Health Briefing for a while, you know how many times I have expressed gratitude for being in California, where our health leadership has been at the forefront of keeping us safe. And sadly, I cannot express any of those sentiments today. What I will say is that my understanding is that counties can choose to stay aligned with the CDC. They could even go above and beyond the CDC, as they have many times during the pandemic so far, and the school districts can follow suit. The other thing I will say is I would just encourage us all to dig a little deeper to try to understand the ways in which schools were not serving all children equally and continue to not serve all children equally, and the ways in which these new policies are taking us even further down a path of exacerbating inequities for children of color, low-income children, children with disabilities, those with immune compromise, let alone their families and household members. This is truly a disappointing day for the health of the public on the West Coast. And while I'm normally hoping that California is leading the way for the nation, this is one time I hope we are not. So as you could probably guess, our guidance remains the same. If you test positive, contact anyone you are around, especially unmasked, for the few days before you started symptoms or tested positive. It is still the right thing to do. Please do an antigen test to exit isolation. If you must go around others, wear a well-fitted N95 mask. That would be considered source control. And unfortunately, children can't wear a fitted N95 mask in many cases because their faces are too small and we don't have N95 masks for them. And so I really am concerned, particularly about vulnerable children and immunocompromised children who are really, frankly, going to be unable to protect themselves in this situation where you have overtly contagious people coming to class with them. So I still recommend that we have folks test before they come around others. In general, we believe that enough virus to detect is enough to infect. We also believe that you should not push yourself, and we should not send a message to our children that they should push themselves. Allow yourself the time you need to fully recover. We know that not resting is even correlated potentially with later developing long COVID. So I still believe we should be encouraging rest and full recovery. Also, we're supposed to be avoiding reinfections. We say that every week, avoid infection and reinfection. We have no idea what the impact of repeat infections year after year on our children is going to be, but what we do know is not reassuring. Remember, there doesn't seem to be an upper limit of how many times you can get COVID. And following COVID, we are seeing increased risk of impacts on almost any organ system. We're seeing new onset diabetes in children following COVID. And this could happen after the first infection, but it could happen after the second or after the third. Catching COVID once and doing fine is not a guarantee about the next time. And every infection is a new opportunity, perhaps even a compounded opportunity for long COVID and post COVID impacts. So let's keep up our best practices and not only keep them up, but maybe step them up at this point, because at this point, the guidance, particularly for those of us in California and in Oregon, the guidance is basically giving a green light to anyone who's COVID positive, who's infectious, to just get on out there and mix it up without even wearing a mask, even though it's a little footnote of a recommendation. That is just super concerning. So, if you want to avoid catching COVID, wear a mask, stay up to date on your vaccination, gather outside. That's just about always safer than inside. Let's really pay some good attention to ventilation and filtration. Like now, this is super, even more important because you may really have someone just filling up the room with some SARS-CoV-2 particles. So to the extent we can open up those windows or have some good ventilation and filtration going, this really could reduce the risk of essentially super spreaders happening every day. And let's keep up all of our good habits in general for better health. Let's try to eat a balanced diet and avoid processed foods and sugary drinks. Get some regular physical activity. Again, unless you don't feel well, in that case, get your rest. Remember, if you don't have a primary care provider, please get one. Know how to reach them before you need them. Get your blood pressure and your baseline labs checked, like sugar and cholesterol. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.